Hello everyone, today we are going to see about fluoride, especially the role of fluoride. 6 roles. First one is increased enamel resistance and reduction of enamel solubility, increased rate of post-eruption maturation, demineralization of incipient caries. Fluoride acts as an inhibitor of demineralization, interference with plaque microorganism and modification in tooth morphology. First, increased enamel resistance and reduction of enamel solubility. In a newly erupted teeth, the enamel structure has a carbonated apatite which is more soluble in acid. In a mature tooth, hydroxyapatite crystals will be there which is less soluble in acid. After the application of fluoride either systemically or topically, it forms in a mature tooth with fluoride forms a fluoroapatite crystals which is least soluble in acid. There are two concentrations of fluoride. One is low concentration and another one is high concentration. Low concentration applied by systemic and high concentration given as topical. The low concentration of fluoride reacts with the hydroxyapatite crystals and forms a fluorohydroxyapatite crystals and loosely bound fluoride, and it will forms a fluoroapatite crystals. The high concentration of fluoride reacts with the hydroxyapatite crystals which is present in the tooth, forms a calcium fluoride and phosphate and hydroxyapatite crystals. The hydroxyapatite crystals and calcium fluoride, it will react with the loosely bound fluoride and forms a fluoridated hydroxyapatite crystals, and this fluoridated hydroxyapatite crystals react with the loosely bound fluoride and forms a fluoroapatite crystals which increase the enamel resistance and reduce enamel solubility. The second, increased rate of post-eruption maturation and remineralization of incipient caries. What is post-eruption maturation? After the eruption of the teeth, it will get mature. It occurs in the hypomineralized area which increases the acid resistance of the tooth, and the remineralization occurs in a demineralized area by deposition of crystalline hydroxyapatite. The demineralized area, what is demineralized area? Whenever there is a drop in pH level or it is in acidic medium, there will be the demineralization will occur. So that time the remineralization will occur. So the basic mechanism is the fluoride inhibit the demineralization and which enhance remineralization. Fluoride acts as an inhibitor of demineralization. Fluoride applied during an acid resistance phase, it will form a it enhance remineralization by inhibiting demineralization. Next, interference with plaque microorganism. Fluoride which increase the cell permeability of the bacteria which rapidly diffuse out of the bacterium, which increase the fluoride content within the plaque matrix. Normally the fluoride which is available in the normal saliva. Modification in tooth morphology. Fluoride applied during the tooth development forms a shallow fissure and smaller cusp decrease in diameter. There are basic mechanisms. The fluoride inhibit demineralization and enhance remineralization. This is a basic mechanism of fluoride. There are types of fluoride application, either topically or systemically. Systemically, it will be community water fluoridation, and topically there is professionally applied, that is by a dentist, and self-applied dentifrices, mouth rinses and gels. Next, technique for application of fluoride. Fluoride application can be done by a painting technique and a tray technique. Tray technique for gels and painting technique for varnish. Dentifrices, nothing but a toothpaste. It is mostly stannous fluoride. Stannous fluoride, it forms a temporary, after the application of stannous fluoride, it forms a temporary layer of calcium fluoride whenever the pH, which acts as a fluoride reservoir. Whenever there is a decrease in pH level or it is an acidic medium, the fluoride starts releasing from the temporary layer calcium fluoride. The fluoride replaces the hydroxyl ion and forms a fluoroapatite crystals. So it is available in commercially available like Aqua Fresh Milk Tea, Durafat 2800 ppm, Oral B Pro Expert, Durafat 500 ppm. It can also applied by a dentist. The technique is called Muller's technique. The tooth should clean with the aqueous slurry water, pumice slurry water. The dental floss should be used pass in between the interproximal area. Teeth are isolated and dried with air. The stannous fluoride is applied using a painting technique, and the solution is kept for 4 minutes in the mouth. And the technique it should repeat every 6 months. Though stannous fluoride in a low concentration forms a tin hydroxyapatite, and it gets dissolved in a oral fluid and gives a metallic taste. So the stannous fluoride in a high concentration forms a calcium trifluorostannate and tin trifluorophosphate, makes the tooth surface more stable and less susceptible to caries. The calcium fluoride forms both in high concentration and low concentration. It reacts with the hydroxyapatite crystals and result in the formation of fluorohydroxyapatite crystals, which will increase the strength of the enamel. Next, the gels. Mostly, it is acetylated phosphate gels, acetylated phosphate fluoride. The concentration is 1.23%. After the application of APF, that means acetylated phosphate fluoride, in the dental biofilm, nothing but a dental plaque and saliva, it inhibits the dissolution of hydroxyapatite crystals by decreasing the acid production by interfering with the metabolic activity of bacterial state that produce acid, which enhances the remineralization of the damaged blood by forming a fluorapatite crystals. There are commercially available Clean Pro and Crevitic gel. Crevitic gel is mostly applied in a hypersensitive area, that means in a root exposed area. APF gel are also applied by a dentist by a technique. The patient should sit in an upright position and he should undergo scaling, that means oral prophylaxis. The patient should instead not to swallow anything before starting the procedure. It can be applied by a tray technique. The gel should be poured in 1/4 of the tray and it kept in a patient mouth as the patient to bite slightly and the saliva ejected is kept. That means the suction is kept. All the excess saliva or the excess material, it will eject from the saliva eject. It should be kept in the tray. It should kept for 4 minutes and the patient instead not to eat or drink or rinse for at least 30 minutes. After application of APF gel, it initially leads to dehydration and shrinkage of hydroxyapatite by formation of hydrolysis. It forms a dicalcium phosphate dihydrate which highly react with the fluoride, and this fluoride penetrates into crystals deeply through the openings produced by shrinkage and leads to the formation of fluorapatite crystals. The fluorapatite crystals which increase the enamel strength. Next, varnishes. What is varnish? Varnish are fluoride along with the alcoholic solution of resins forms a varnish. After the application of varnish by a painting technique, if the organic solvent evaporates, the varnish set exits when it exposed to moisture and it forms an insoluble calcium fluoride which occludes the dentinal tubule. Whenever there is a decrease in pH level, this layer start releasing the fluoride from the dentinal tubule. There are commercially available Durafert 50 mg per ml, Duraflor 5% sodium fluoride, Florimax 2.5% sodium fluoride, and Prevident 5% sodium fluoride. The main disadvantages of the varnish application, it may discoloration. It may cause discoloration of the tooth. Next, mouth rinses. Mouth rinses is mostly sodium fluoride. This sodium fluoride interferes with the metabolic activity of bacteria by formation of lactic acid, and it inhibits glycolytic metabolism in bacteria, changes the permeability of cell membrane by decreasing the pH of the cytoplasm of cell, decreasing the acidity and remineralization of enamel. So there are commercially available mouth rinses: ACT mouth rinse, Crest Pro Health mouthwash, Dentate's Fluorescent mouthwash, Listerine Total Care Anti-Cavity mouthwash. So it is the first fluoride compound to be used for topical fluoride application. Minimum 4 applications should be given. So this is the main disadvantage of sodium fluoride. It can also be applied by a dentist. The patient should undergo oral prophylaxis. The teeth should be isolated either by a quadrant or the half the mouth. So the 2% sodium fluoride solution painted on an air dried teeth so that all surfaces are visibly wet. Allow to dry for 3 to 4 minutes. Repeat on each segment. So second, third and fourth application of sodium fluoride at intervals of approximately 1 week. So sodium fluoride reacts with the hydroxyapatite crystals and forms a calcium fluoride. The thick layer of calcium fluoride forms which interferes with the diffusion of fluoride from sodium fluoride solution to react with hydroxyapatite and blocks further entry of fluoride ions. So the calcium fluoride react with the hydroxyapatite crystals and forms a fluoridated hydroxyapatite crystal. So when there is an increased amount of fluoride content on an enamel surface, which is increase more resistance against the decay teeth. Thank you.